Hi.
Hi,
Hello.
Manisa. I'm Dr. Arden. Nice to meet you. So I see you're coming in for some lower back pain. You slept wrong. It started about 3 months ago.
Yeah.
As well as headaches that started a couple months ago as
Yes.
well. Right knee pain from working out.
Yeah.
And that started a year ago and just hasn't gone away.
Yeah.
All right.
No,
So
yeah.
tell me about it. Tell me about what's going on.
So I have been having lower back pains ever since 3 months ago. Every time I wake up, I just wake up a little bit more achy in the morning. I do my stretches, but even then, I still feel like when I stand up, I feel like a little bit of some pain right there.
Okay.
It's
What kind of stretches do you do?
I do some lower back stretches,
Lower
so
back.
kind of more touching toes.
Okay. Is there anything that makes your lower back pain worse?
Mainly when I do stand up, I've noticed when I do put my shoulders back a little bit, I can feel the pain a little
So whenever
bit.
your posture's good.
Yeah.
All right. Tell me about these headaches.
So I've been having some headaches. I believe since like 6 months ago. I think they started. I think from stress possibly.
Where do you feel your headaches the most?
Mainly around here,
Okay.
towards the front.
And then does anything make those headaches better?
Usually maybe taking Advil.
Advil, okay. Right. How long do those headaches usually last?
Probably like 5 minutes.
5 minutes, okay. All right. Tell me about this knee pain from working out. What were you doing?
So I was I'm trying to remember. I was lifting.
Okay.
Yep. So I ended up pushing my limit, and then I ended up kind of, I guess, pulling something.
Okay.
Yeah.
Can you point to exactly where your pain is?
Right around here.
Okay. And then is it like a dull pain, achy pain, or like sharp stabbing?
Kind of like achy pain.
All right. Besides your lower back pain, your headaches, and your knee pain, do you want to go over anything else today?
I think that's all.
That's all?
Yeah.
Is all of this pain, is it stopping you from anything? Is there a goal that you would like to accomplish?
Kind of stopping me from getting better with my posture.
With your posture, okay. So the biggest thing we'll work on then is that posture, okay? I also see you've never been to a chiropractor before. Well, you can go to 10 different chiropractors and get 10 different explanations. So I'm going to tell you just a little bit about what we do in the office. So we look at your spine as a whole, all right? Your brain sits on top. It's going to send signals all the way down. Those signals come out nerves. Those nerves are at each single level, okay? Those nerves control everything in your body. Muscles, your organs, your tissues, your cell, anything you could think of. You can walk, you can talk, you can eat, digest, you can have the knee pain, have the lower back pain, have the headaches, or not have any of that. It's all based on if those nerves are functioning properly, okay? So what we're gonna do today is we're gonna test those nerves from head to toe. Because you could be having headaches coming from your lower back, and you could be having lower back pain coming from your headaches. We never know where your symptoms are coming from, all right? And then what I'm gonna do is we're gonna put together a report for you. We're going to see if you're a good chiropractic candidate. If you are, we'll get started right away on care.
Okay.
If not, I'll make sure to refer you out to the best of the best so we can get you out of this pain, we can get your posture looking better, and help them with that, okay?
Thank you so much.
You're so welcome. So now what I'm going to do is just ask you a couple general health questions.
Yeah.
These questions help us kind of get a deeper meaning of what's going on, because each of these questions correlates to a nerve on the spine, okay? Do you ever get blurry vision?
No.
No. Do you wear glasses or contacts?
No.
No. Do you ever have ringing in your ears or trouble hearing?
No.
Any trouble smelling or swallowing?
No.
Any shortness of breath?
Yes.
Besides walking up the stairs?
Yeah.
Okay, just walking.
Actually, no. Actually, apart from
Okay.
that, no.
Any acid reflux or indigestion?
No.
Do you go to the bathroom at least once a day?
I do.
You do? Big reason we ask that is some people that do have lower back pain, those nerves in your lower back control your bowel and your bladder. So a lot of people that do come with lower back pain are constipated. Okay. Any weakness or numbness in your hands, feet, arms,
No.
or legs? Any unexpected weight loss in the last couple months?
No.
Have you ever experienced any vertigo, nauseous?
No.
Have you been diagnosed with any anxiety or depression? Any memory loss?
No.
Any chance you're pregnant? And any chest pain?
No.
And last one, how's your sleep at night?
I do try to get about 8 to 9 hours
Okay.
of sleep.
Do you have any trouble falling asleep or staying asleep?
No, not really.
Okay. Alright, so now that we're done with the history part of the exam, I'm going to move on to the physical part. So I'm going to have you sit up on the table for me, and I will be right back. Okay, back. Alright, so the first thing I'm going to do is I'm going to test your reflexes, okay? So reflexes are a good test because one, you can't control them, and two, it gives us good data because we're testing a specific nerve. So the biggest thing is you don't have those two reflexes, alright? We call that C5.
Okay.
So C5 sits, I'm just going to your hair, okay? C5 sits right back here in your neck.
Okay.
Alright, so again, contribution to those headaches is a lot where that could stem from, okay? Alright, C7. Now, a lot of people don't have this one just because they're forward with their posture. Good. Good. Alright, so into your lower. Alright, so this is called S1. This one was decreased on your right side, okay? That nerve comes from right back here on your back.
Okay.
So the thing you're saying about your or your lower back pain you're experiencing could be from that, okay? Alright, the next thing I'm gonna do is I'm gonna test your muscles, okay? I'm not testing to see how strong you are, I'm testing those nerves, okay? So I want you to put your hands up like this. Don't let me push down. Good. Good. Actually, put forward like this. Bicep curl. Pull towards yourself. Good. Pull towards yourself. Alright, push your hands to me. Push your hands to me. Good. Put your wrist down like this, and then wrist up to the sky. Hold it strong. Hold it. Yep, hold. There you go. Good. Hold. Good. Keep over. Alright, hold this for me. Don't let me pull them apart. This one's kind of weird. So that nerve comes from right back here. It's related to C7 and T1. So it's a lot of that forward carriage, a lot of that posture, okay? Last step like this for me. And don't let me, I'm gonna try and pull your fingers out. Don't let me. Good. Alright, I'm gonna bring your knee up to the ceiling for me. Is that hard for you? No? Alright, push against me. Good, pull against me. Push against me. Good, pull against me. Alright, close up to the ceiling for me. Alright, hold strong. Alright, you see how both of those are weak?
Yeah.
So that's that same S1 where your reflex was decreased, is right back here. A lot of it has to do with S1 is your sympathetics, so it's your stress. Alright, so it could just be that you're stuck in that sympathetic with your stress, what you're saying with your headaches, and the tension headaches you're experiencing, so it all correlates over. Alright, toes up to the ceiling, or down to the ground, sorry. Down, don't let me pull up, hold strong. Good, hold strong. Good. Alright, next thing I'm gonna do is range of motion. I'm gonna have you stand on up for me. There's usually two reasons people can't do range of motion. Either the structure of their spine has a curve in it, so it physically can't look one way or the other, or the muscles around your spine are so tight and being so spasmed that it's gonna hurt to look one way or the other, okay? I want you to bring your chin to your chest for me. Is that all you can do? Oh, as far as you can.
Oh,
there
okay.
you go. Okay, look all the way up for me. Any pain pinching or pulling?
No.
Okay. I want you to look to your right as far as you can. Look to your left as far as you can. Good. Alright, right ear to right shoulder. Go to left ear to left shoulder. See how much further you can go to your right than your left? So again. Alright, I'm gonna bend over and touch your toes for me as far as you can. And I'm gonna run my fingers down your back, okay? Alright, come on up for me. Are you right-handed?
I am.
Okay. Oh, your right side is highly narrow.
Oh, yeah.
Hands on your hips for me, and you're gonna extend back. Any pain, pinching, or pain?
Yeah.
Good. Alright, hands by your side, and you're the same thing we did on neck, you're doing it on your lower back, so I want you to tilt for me. Okay, and tilt. Any pain pinching or pulling on that side?
No.
No. You can go further to your right than your left.
Oh.
Okay. So it could be a contribution to your lower back pain you're having as well. Alright, last thing is I'm gonna have you sit down, okay? Alright, so what I'm gonna do is I'm palpating down your spine. I'm just gonna feel. I'm looking for those vertebrae to move separately. When they don't, a couple things happen. Alright? They're gonna, one, get stuck, lock up. It's gonna hurt. It's gonna cause those muscles to contract to protect that area. But it's gonna shut that nerve off. When that nerve gets shut off, it leads to faster bone degeneration and disc degeneration, which eventually leads to arthritis, and we wanna avoid that, okay? I'm gonna palpate. So a lot of the time, your C1, C2 are headaches. You've never been yesterday.
I have.
So the biggest thing is up here. C1, that's a headache bone. So it could be a reason you're having headaches is because those bones are just misaligned. When that bone misaligns, it's compressing that nerve. Then that nerve can't get to where it's supposed to be. And going down your neck, your entire right side. Even where that C5 reflex, I can tell that you have a stiff neck. And the biggest thing, like you talked about, your posture, wanting to work on that, you're very forward. So when you're very forward, you're compressing down here. So I'm gonna move these. The big thing we're gonna work on is working on that posture so we're not compressing here. I'm gonna go down into your back, okay? I'm gonna put my hands on your hips. So do you feel how tight it is down here?
Yeah.
So it's not just muscle that's tight. When your muscle's tight, it's protecting your spine. So we know that that nerve then is being shut off. Same thing down here, okay? Alright, so what we're going to do is we're going to take some x-rays because you can't hide from pictures to see what's going on, okay? So I'm going to have you stand here for a second. I'm just going to face x-rays of it. Alright, done. Alright, so, and then I'll want to show you. Alright, so here are your x-rays. I do want to take time before I leave the clinic to go over your x-rays, draw some lines on it, go over all the information I found today, and put together that report I was talking about. Again, if you're a good chiropractic candidate, we'll get started right away on care. If not, we'll make sure to refer you out to the best of the best, okay? Could you come back maybe the next 2 to 3 days to go over your results?
Yeah.
So today's Wednesday. Could you come back maybe Friday or Monday?
Yeah.
Alright, perfect. Does morning or afternoon work?
Morning.
Morning? Okay, perfect. We'll go get that scheduled.
Perfect. Thank you.
Thanks.